One of the mysteries of what's going on in Alberta and BC with regards to COVID-19 mitigation policy, because we've got Alberta, the hospital system is essentially collapsing under the weight of COVID infections, and BC is not far behind. But one of the mysteries is why? What's going on that is inhibiting public policy from dealing adequately with the problem? And you will be surprised to learn that there's behind the scenes, this is not really visible to the public, there's a fight going on between the public health and medical science establishment, we'll call them, and a group of scientists who are in a different part of the science community who take a different view on how COVID-19 is transmitted. So I'm going to talk to Professor Jose Luis Jimenez, who's a professor at the University of Colorado at Boulder. And welcome to the interview, Jose.
Thanks for having me.
Now, have I adequately described the debate between the two camps around how it's spread, which basically is droplets and contact versus aerosol, which is fine droplets, almost like smoke?
Yeah, correct. That's a good description of the debate. And at the beginning of the pandemic, we were told by WHO or the public health authorities in British Columbia that this was a droplet and contact disease, droplets that fell to the ground. So they could, two people were talking, they could impact you in the eye, but if they didn't impact you, they fall to the ground and they are no danger. Or by contact, so you have to wash your hands and disinfect surfaces. And WHO went as far as saying that to say that it was transmitted through the air, through aerosols, was misinformation. And we all had to help WHO fight this misinformation. This was March 2020. But really that position was only changed in April of this year by WHO or the British Columbia authorities to admit that, that transmission through aerosols that don't behave like projectiles that fall, but rather they float like cigarette smoke and we get infected by inhaling them, that this was important. But it was already clear a year ago that transmission through aerosols is not just that it is important or noticeable, it's the main mode of transmission and probably is the only important mode of transmission. Yet we encounter these public health officials which are following outdated theories and are very resistant to update what they are recommending.
And the issue here for the average viewer who's watching this is that depending on which camp you're listening to, you get different policies are required. So for instance, if it's the droplet and touch camp, then they worry about social distancing, keeping 6 feet apart, and masking, which is great. But if you're in the aerosol camp, now you're worried about ventilation and filtration in rooms, and being further apart than 6 feet really doesn't make much difference. And it leads to a different set of policy recommendations that could have very significant outcomes or impacts on on infection numbers. Have I got that right?
More or less. I mean, we have not controlled the pandemic because we have not told people how the virus is really transmitted, and we have wasted huge amount of efforts in surface disinfection and plexiglass barriers and things that don't do anything, or in some cases like plexiglass barriers, they actually increase transmission, because they make ventilation difficult. So what you have to think in terms of how to prevent transmission is just the physical description. Out of some people who are infected leaves an invisible smoke, and you get infected if you breathe it in. So, and you get infected especially in one of two situations. When you talk close to someone, if one person has eaten garlic and you smell the garlic strongly, that's because you are just inhaling without much dilution the air that has left that person. So distance actually is very effective, but it's not very effective because the droplets fall to the ground, but because you breathe in less of the air that leaves the other person. Masks are now a filter. They are not a parapet to stop these droplets, but they are a filter that are the aerosols are gonna stick to it. But indeed, it becomes clear that doing things outdoors where aerosols are diluted much more is very effective. In fact, it's the most effective measure we have. and ventilation or filtration, which is trying to make indoors a little more like outdoors and remove the virus from the air, are also extremely effective. And hand washing is nice, mostly for other diseases, but for this disease, there is actually 0 demonstrated cases of surface transmission through the hands. Yet we keep being told that is the most important measure. There is absolutely no evidence that that's the case.
Now, my understanding, you will co-authored a paper, and there's another co-authored paper that come out recently that explains some of this debate and explain why the public health establishment is committed to the sort of droplet theory. And one of the defenses of the establishment is that scientists like yourself are not doing good medical science, that your results are illegitimate or they're not credible. And I just a couple of days ago, I had a professor from Alberta comment on an interview I did with Dr. Kimberly Prather, who you've co-authored with, about aerosols. And she said, no, that's not credible. This is not credible, not a credible source. Whereas Kimberly Prather is a world-renowned expert on aerosols. And it's that dismissive attitude towards the new science that's coming forward. Is that what you're finding? Is that common?
Oh yeah. We've been called ignorant by WHO and by WHO's panel of experts. We've been called ignorant, uninformed, and what are we doing commenting on this issue in which we have no training? When this issue is the travel of aerosols through the physical world, which is our specialty. Kimberly Prather is a member of the National Academy of Sciences and the National Academy of Engineering in the US. She's one of the foremost aerosol experts worldwide. How is she not credible to comment on how aerosols? I mean, this is just absurd. But we encounter this kind of this moat around a certain sector of medical science and infectious disease science, and they feel that they are in possession of the truth. I mean, and this has been, as we say in Spanish, the problem has been that everyone who has the pan by the handle, they are all from this discipline. And the people who actually understand aerosols are all outside, and they keep ignoring us. And it has been really a struggle to get them to listen.
Is it fair to say now, because I've heard doctors make this claim, that there's enough science now, enough papers have been published, enough research has been done, that the aerosol theory is well established? There's enough science been done.
I mean, I think it was well established by August of last year, of 2020. After August of last year, I have not found a scientist who is willing to debate scientifically and tell me why the aerosols are wrong. Intellectually, the battle was won in August of last year. And really, we had enough evidence. In March of 2020, we started investigating the Skagit choir outbreak in Washington State. And the moment I talked to the choir and they explained to me in great detail what they had done, it was obvious this was airborne. And I started calling all the journalists I knew and saying, we have to give the alarm, this is airborne. And basically nobody published anything because they said, I called a doctor and they said, no, it's not airborne, and they are credible and you are not. So that unfortunately delayed controlling the pandemic by many months.
Well, and let me give you an example that's come up in my own reporting. So for instance, doctors, Dr. Bonnie Henry, who's the public health officer in BC, and Dr. Dina Hinshaw, who's the public health officer in Alberta, they don't accept this science. And so they don't recommend to school boards that they provide extra filtration in their schools. And yet Dr. Prather and others are promoting these Corsi Rosenthal boxes, which are very simple, cheap filters that can be put in classrooms and can essentially remove the COVID-19 virus from the air. But without that approval by the establishment at the top, down in the classroom, we're losing a very important means of combating the pandemic. And these are the implications, the practical day-to-day implications of not accepting the science. Are you finding that as well?
Yeah, I mean, this happens unfortunately in more places than the two that you mentioned. But I think those public health officers in British Columbia and Alberta are among the most stubborn. And I have found during the pandemic, Canadian infectious disease experts, for whatever reason, are kind of like among the most fundamentalist about this kind of droplet and contact theory of disease, and the most unwilling to listen to the science, and the most believers on this mode that really people like me have nothing to say about this. I think this attitude is irresponsible, and I would go as far as saying criminal. Ignoring science and exposing children and teachers to a deadly virus is just, I can think of more words that I shouldn't say in an interview.
No, like I understand the outrage. I mean, we're talking about lives, we're talking about the health. Bad enough when it was adults. Now that the Delta variant is getting into and infecting children, that puts it on a whole another level. I get that. The question here is, why are Canadian public health officials so conservative? But let's, in your experience, you're talking to public health officials in other countries and across the US. Are they more open to this new science?
It varies. I think it varies how committed people are to the old science or how open they are to the new science. And barely any public health officials have embraced aerosols quickly. They have all taken a long time, but some of them have been more open-minded, and by now they are working with us, and I've talked to many of them. And then there are some that are really lagging behind and persisting on the old positions, and these include people like Bonnie Henry. Why this is, there is a few reasons really why there is such resistance. One is, and I think without history, we cannot understand. This droplet theory comes from 1910, when an American public health researcher, Charles Chapin, says, without evidence, that transmission in close proximity is because of these droplets that can fall to the ground, and that transmission through the air is almost impossible. And the problem is he becomes too successful, and this becomes a dogma until this pandemic, right? So now infectious disease doctors have never put much effort to study aerosols because transmission through aerosols is almost impossible. So the moment they open their mouth, they make enormous mistakes, right? And the problem now is that as the evidence has accumulated, there is many researchers that, they refuse to abandon that tradition. They also don't want to lose face. They don't want to lose face and admit that they made such a blunder, or they continue to make such a blunder, and that has led to people being infected. And then I think there is a third reason, that politicians also find it convenient, because if things transmit through droplet and contact, when there is an outbreak, you can blame people. You didn't wash your hands enough. That's what they did. WHO did with the choir. They said they didn't wash their hands enough, which was absurd. When they knew about surfaces, they didn't touch their hands. But if you admit it through the air, then institutions and companies and whatever have to do things. They have to do ventilation. That's not something an individual can always control. So they find it convenient to open up the economy quickly and whatever, with less controls and not having to make an effort in the schools, because if you deny airborne.
Well, I mean, to an observer like myself, it seems only sensible that this is the explanation for why, even though a province like British Columbia has brought in public health measures. I mean, it's not like, Dr. Bonnie, I don't think she's been negligent. She's, they tried all kinds of things. And now we have vaccine passports as an example, which is seen as fairly aggressive intervention in the Canadian context. And yet infections continue to rise, and our, people infected COVID patients are now, flooding ICUs in British Columbia. And I think, the public wants to know why. And this seems to be a reasonable explanation of why.
This is the explanation of why, because we are not telling people how the disease is transmitted clearly, and we are not implementing in a widespread way the measures that really work. And I think in many places we're still wasting a lot of time and money on things like disinfecting surfaces, or we are not removing plexiglass barriers that actually increase transmission. So I'm convinced this is a key reason why we haven't controlled the pandemic. If you think about the beginning of the pandemic, the R0 number, meaning how many people an infected person infects, was about 2.5. To control an epidemic, you need to get that R number below 1. So you need to reduce transmission from 100% if we do nothing, we don't know there is a virus, to only 40% of that number. It wasn't that hard to stop the pandemic at the beginning, yet we failed completely in all the countries. Why? Because we were not doing things that were effective. Other than lockdowns or of course vaccines now, whether those things are effective against any mode of transmission. But this has, in my mind, been a key problem.
Sure, and we know that 20 or 30% in BC and Alberta are not vaccinated, and so there you have the COVID-19 running wild through the unvaccinated population, and then we have breakthrough transmission for some people who are even double vaxxed. Despite the efficacy of vaccines, there's still a need for these other measures, and it goes a long way to explaining, I think, why we're having the trouble we are. But Jose, thank you very much for this. Really appreciate your insights.
Thanks very much for having me.